Animal lover, welcome to my channel. I hope you are all doing well. This channel is exclusively for those who love the animal. I hope you would like this and follow and subscribe the channel. So, the more common problem occur in these days in the animal, large animal or the small animal or in pets is the colic we usually sees in the this colic. So we are going to check what is in colic, where is colic, colic CEO coccidiosis in poultry, cattle, coccidiosis, colic in horses. So first thing we would going to tell you, as being a veterinarian doctor by myself, I would tell you about this colic in horses. Overview of colic in horses and disease associated with colic in horses by anatomical location, as we all knows that colic definitely in the abdominal region. So overview of colic in horses. In its strictest definition, the term colic means abdominal pain. Throughout the years, it has become a broad term of variety of condition that causes a horses to exhibit clinical signs of abdominal pain. Consequently, it is used to refer to conditions of widely varying etiologies and severity. To understand these etiologies, make a diagnosis and initial appropriate treatment, veterinarian must first practice the clinical relevant aspect of equine gastrointestinal anatomy, the physiological process involved in the movement of ingesta and fluid along the gastrointestinal tract, and the extreme sensitivity of the horses to deleterious effect of the structural component of the bacteria that reside within the intestinal lumen. Gastrointestinal anatomy of horses. Horse is, as we all know, is a monogastric animal and it have a relatively small stomach compared to the buffaloes and cows. Capacity 8 to 10 liter, located on the left side of the abdominal beneath the rib cage. The junction of the distal esophagus and the cardia is functional one-way valve, permitting gas in and fluid to move into the stomach but not out. As we know, the gases did not, the horses did not vomit. So in the next video, we would ask this question from AI chatbot and learn what is their answers. Consequently, condition that impede the normal abnormal movement of gases and fluid through the small intestine may result in a severe dilatation and rupture of the stomach. Because of its position, the stomach is difficult to visualize with radiography or ultrasonography in large adult horses. So it is very difficult to diagnose by using radiography or ultrasonography. The smaller size of the fold, however, permit assessment of gastric emptying by means of constant contrast radiography. The small intestine comprises the duodenum, jejunum, and ileum, with the latter joining the cecum at a distant il- ileocecal junction. The duodenum is positioned primarily dorsally on the heart's right side, where it is suspended from the dorsal body wall by a short mesentery of 3 to 5 centimeters in length. As said, the duodenum is not involved in small intestinal displacement involving the mesentery volvulus at the base of the cecum in the right parallel fossa region. The duodenum turns toward the midline. It is at this point the duodenum is distended with gas or fluid. Example in nurses with proximal enteritis can be felt or palpation per rectum. As the small intestine reaches the dorsal midline, it turns currently its mesentery lengthens and it becomes known as the jejunum. So this is the anatomy of the horse. Blood supply to gastrointestinal tract. The celiac and the cranial mesentery cortical branches of the abdominal aorta supply blood to the gastrointestinal tract. And then natural opening in the abdomen. There are several natural opening or spaces within the abdominal cavity that can be important in conditioning causing colic. The inguinal canal provides an opening through or common in young foals. They really cause clinical problem. The situation is considerably different in swollen. Similarly, if the ventral abdominal wall fails to form up properly around the umbilicus. An opening remains, and the potential exists of the intestinal problem to develop secondary to an umbilical hernia. Colic, colonic mortality patterns, clinical finding, numerous clinical signs are associated with colic. The most common signs include pawing repeatedly with the front foot, looking back at the flank region, curling the upper lips, and arching the neck. Diagnostic clinical evaluation by the veterinarian doctor, not by the owner of the horse by himself, and clinopathological tests that we do in lab to check is either it is colic or some other pathological condition in the horse.